Hi everybody, my name is Carter Stahl and I would like to educate you all today on the basics of skin cancer, including what it is, the different types, and finally how it can be treated. Each year there are 13.8 million cases of reported skin cancer in the United States alone. According to the American Cancer Society, there will be more new reported cases of skin cancer this year than reported cases of breast, lung, prostate, and colon cancer combined. Skin cancer is very common, it does not discriminate, and it is very easy to acquire. To better understand skin cancer, we will start off by talking about what skin cancer actually is. According to the Gale Encyclopedia of Cancer, cancer can be defined as a group of diseases in which abnormal cells continuously grow out of control. So therefore, skin cancer can be described as the growth of abnormal cells on the skin. Skin cancer is the most common form of cancer, but it is not the most fatal. According to the book Skin Cancer by Stahl and So, 1 out of 3 diagnosed cancers will be a form of skin cancer. Skin cancer mainly used to affect the older generation, especially men who worked outdoors, but these days we're seeing it affect the younger population due to the trend in fake tanning. And according to the Relay Clinical Education, there are people who are at greater risk for skin cancer than others, people who are fair-skinned or freckled or around a source of radiation or even work outdoors. According to the book Skin Cancer by Stahl and So, exposure to the sun is no longer the only known source of skin cancer. Exposure to other things like radiation and arsenic are known to cause skin cancer. There are other causes like hereditary causes, organ transplants. People who receive new organs need to take immunosuppressive drugs, which are known to cause a type of non-melanoma cancer. And the human papillomavirus can interrupt your skin's normal defenses against damage to skin cells, so this will make you more susceptible to developing skin cancer. So now that we have kind of a better idea of what skin cancer is, we will go on to talk about the different types of skin cancer. There are 2 main groups, melanoma and non-melanoma. The melanoma group contains only melanoma type cancer. The non-melanoma group contains 2 types of cancer, basal cell carcinoma and squamous cell carcinoma. Keeping with basal cell, according to the Gale Encyclopedia of Cancer, it is the most common type of skin cancer, accounting for 80% of all diagnosed cancers. It is developed in the lowest layer of the skin called the epidermis, next to your basal skin cells, which are responsible for producing new skin cells. It grows very slowly, but if it stays undetected, it certainly has the potential to spread throughout your body. It has an appearance of a shiny, red, translucent, wrinkly spot on your skin. Squamous cell carcinoma is the second most common type of skin cancer. It is found in the keratinizing layer of the skin, which is the layer just below the surface of the skin. It appears scaly and slightly elevated on the skin. It grows much faster than basal cell carcinoma, and so therefore there's a much greater risk of it spreading throughout your entire body. Going back to the melanoma group, talking about malignant melanoma, it accounts for 5% of all diagnosed skin cancers, but accounts for 85% of all skin cancer related deaths. So it is the least commonly diagnosed, however most common when talking about death and skin cancer. It develops from pigment producing cells called melanocytes. Melanocytes produce pigment cells that protect your skin. The darker the pigment cells you produce, the more protection you have, hence the lighter pigment cells you produce, the less protection you have. Malignant myeloma is very aggressive in its first stages. It starts from a brown mole on your skin. Everyone has them. Most of them are benign. But if these moles do, however, encounter a genetic mutation and become abnormal or cancerous, they can very quickly develop into a primary melanoma tumor, in which it goes through horizontal growth of changes in color and shape. From there, if it stays undetected, it can go into a vertical growth phase where it actually grows deeper into your skin and then deeper throughout the rest of your body, spreading completely. When it does this, it is said to metastasize, and then it will then be called metastatic melanoma. So now that we've gone through a few of the basic types of melanoma, or excuse me, a few of the basic types of skin cancer, we will now look at the different treatments available. And according to the Gale Encyclopedia of Cancer, the type of treatment you use really depends on the type of cancer you have or the severity of your case. There are 4 main types of treatment. They are surgery, radiation therapy, chemotherapy, and photodynamic therapy. Surgery is the most common, and this is the treatment used when the tumor is really localized or easily removable. There are 5 types of surgery: excision, which is cutting out the entire tumor; cryogenic, which is freezing the skin cells; laser surgery, which is using a beam to cut out the tumor; dermabrasion, which is just for superficial tumors; but Mohs microscopic surgery is one of the most popular. It deals with just shaving off very thin pieces of the tumor and then taking those shaved off pieces and looking at them under a microscope just to tell how much further you need to shave down to get rid of the cancerous cells. Mohs micrographic surgery is said to have a 96% cure rate, so that's why it is very popular. Going to radiation therapy, this therapy is used for when skin cells are on the face. They like to use this therapy because it wouldn't require a reconstructive surgery like other treatments would on the face. Radiation therapy just involves using high energy x-rays to kill cancer cells. Next, talking about chemotherapy, it is one of the most common therapies used for cancer treatment, not only skin cancer. It is used to stop the growth of cancer cells. It can be taken in a pill form. It can be injected into your bloodstream, and it can also be used as a cream for some non-melanoma patients. The only drawbacks to chemo are some of the serious side effects that include loss of appetite, loss of hair, loss of energy, and nausea. So looking at photodynamic therapy, this is one of the newer breakthrough technologies. It involves using a drug and a laser simultaneously. A person takes the drug, subjects themselves to a laser beam that when this laser beam hits the right wavelength and interacts with the drug will activate and therefore kill the cancer cells. And the breakthrough thing about this treatment is that it is much more controlled than all the other treatments, meaning much more of your healthy skin will be spared. So, now that we have learned about what skin cancer is, the different types of skin cancer, and the treatments available, I hope you all have been informed on skin cancer, stayed interested, and I hope you all have become more educated and care a little bit more about the deadly disease that is skin cancer. So thank you very much for your time.